My dear viewers, we have Dr. V. Sridevi, the obstetrician and gynecologist. I'm going to ask Dr. Sridevi, Doctor, can you share about the discharge after the delivery? The women have some discharge after the delivery. Can you able to share about that, please?
Yeah, sure. Thank you. So there might be some discharge after pregnancy, and that's called after delivery, and we call that as Lokia. So how the Lokia usually starts like immediately following delivery and can be there around 2 to 3 weeks in most people. So the initial first few days, the Lokia is red in color. So it's called as Lokia rubra since it's red and mainly contains the blood. And then it becomes pink in color. So that time we call it as Lokia serosa. That's around 3 days to 10 days. And after 10 days, it becomes more pale, like dull in color. That's mainly because of the leukocytes, white blood cells. So it becomes pale and it can be there around 2 to 3 weeks. And for some people, it usually may stop in the second week. And again, they may have it when they start moving around freely. Again, they can have some discharge. So that's about the Lokia. And what is this and from where does it come is, it comes from the endometrium. Usually, as we know, the every month periods is the endometrium. So this also is the endometrium, and this is usually rough because of all the placenta has been attached there, and they might have the decidua, the remaining the placental minimal bits, and all the fetal membranes and also some blood clots. This is what comes out as Lokia, and usually there's nothing to be worried if it's like this, there will be an order, but it wouldn't be foul smelling. So if it is foul smelling or it is very excessive in amount, then it has to be addressed because there might be some infection which has to be looked into. Otherwise it's normal, nothing to be worried about.
Yeah, that endometrium is the covering of the uterine lining.
Yes.
Main thing what we understand is normal discharge after the delivery. It will be there for about 10 days or so. If it is infected, it may be foul smelling and it could be like maybe a pus-like discharge or whatever it is that can occur due to some sepsis. That has to be prevented.
Yes, only that has to be addressed immediately. They have to go for a checkup and see if it's normal. Otherwise, it's nothing to be worried.
Yeah, and this probably they have to be very hygienic. I'm just adding up a point. For example, they cut the vagina. That sometime for some people, that's called episiotomy. That has to be taken care. And even after passing the defecation or the bowel movements, the woman has to cleanse every time because they are very prone for infection. If they put some sutures, that has to be taken care also.
Yes.
That is what the main thing is hygiene, and they have to change the pads on and off. They have to change. They have to keep the area clean, and the hot water sitz bath is very helpful because we have to give comfort. Sometimes the edema may be there after stitch or after cutting the vagina and perineum. That has to be addressed. Yeah, I think we learned something, and thank you very much, Dr. Sridevi.